and then do it. I think that is more safer.
No, you don't really require it.
Okay.
Feel all right? Okay. एक X-ray shot लीजिए please. हाँ रख. Okay. Now धीरे से pull back करना about say half a centimeter, and then we'll show them. हाँ. Shoot करिए. Okay. So this is where the foramen ovale is typically there. Okay. जहाँ पर needle का tip है.
Right.
Okay. Now we are pulling it further. If you look down below, it is just crossing the posterior part of the mandible. The hard palate.
Hard palate.
Now pull it again. Now what Tata is doing is he is feeling the needle just lateral to the buccal mucosa. You are feeling the needle, right? हाँ. थोड़ा और pull करो बाहर. Yeah. Pull it further. Shoot, please. Shoot, please. हाँ निकालो और निकालो. निकालते shoot. हाँ निकालो. अब पूरा निकालो. So he has just gone there, and I want you to feel the third molar, and I want you to feel the mandible पूरा, and just locate where the needle is. You got it? Okay, so I am asking him to feel the third molar. If you appreciate on the X-ray, see we have just gone lateral to the third molar. Lateral में आप लोग को दिख रहा है?
Yes.
Yes, sir.
Yeah, so you feel that on through the finger as well. Take it out further. You want to try Ravi? ठीक है, इसको feel करने दो. So I think the procedure is done. The patient is right now under the effect of propofol. One event that happened was the SpO2 had come to around 89-90. So we did a simple jaw thrust, and again now it is at 99. Bas. So this is at third molar. Now just get it out. I also tend to give a little bit of ice pack, especially if I have had multiple punctures.
Sorry, what do you give?
Ice pack, just an ice pack.
Okay, ice pack.
Yeah. Just clean. One shot of antibiotic I use, and I taper the 𝐒𝐻𝐵𝐷 gradually. So if there are any doubts, I'll be more than happy to answer.
Dr. Asheesh, how frequently you are able to taper and stop carbamazepine in such cases, and over how much period?
So generally, I take about 6 weeks to 8 weeks to gradually taper. There is also an element of psychological dependence of all these drugs. Like we saw what Deepak was presenting for pregabalin. Similarly, there is a little bit of for 𝐒𝐻𝐵𝐷 or carbamazepine group as well. So it is better to gradually taper it off. And as far as your question is, I would say around 50 to 60% of my patients, I really don't have a hard data, but I am assuming that about 50 to 60% of my patients are totally off drugs, and the rest may be on minimal amount, mostly SOS basis.
Dr. Asheesh, do you use baclofen in any of your patients?
Asheesh, the question is, do you use baclofen in any of your patients?
Yes. So I use, so my first choice is carbamazepine or 𝐻𝐻𝐵𝐷. I have had limited experience with the newer carbamazepine, though it is an OD preparation, but not a lot of experience, just a few cases. So that is the drug of choice, I would say. The second is I go for pregabalin at 50 milligrams to begin with. If not, then I use either phenytoin or I use baclofen. Though I would say that lamotrigine also is very potent, but then as you are well aware that lamotrigine has a lot of dermatological and other side effects, and it has to be really gradually increased vis-a-vis the other group of drugs which you can sort of increase a little faster. So lamotrigine for me comes a little later.
Yes.
Sir, 2 minutes के लिए OT number 1.
Okay, Asheesh, we'll have to interrupt you.
Sir, OT2 connected, sir. Just for 2 minutes, I wanted you to show my patient when we did cesarean and
Yes.
and he's
Thank you.